Hello, I'm Dr. Sarah Bohn with You Only Die Once, where we discuss serious illnesses and various ways to manage concerns as disease progresses, advance, and end of life nears. The topic for today's video is nausea and vomiting, and I apologize in advance because there's some intricate information that I provide in this video. These symptoms are distinct but often overlapping. They cause so much distress that the quality of life can be negatively impacted. These terrible symptoms disrupt meals and thus family time. They contribute to weight loss and promote frailty and weakness. They disrupt sleep and can lead to fatigue, and they can decrease a person's mobility. Having these symptoms, you may just want to be in bed or hold still, so they limit your ability to interact with others. This is an annoying problem that can rob you of your daily joy. There is significant patient and family frustration over the difficult management of nausea and vomiting because symptom control is actually quite complex. My goal today is for you to learn a little bit more than what you already may know about these symptoms and help you gain some insight to this problem. You've got a greater understanding of the complexity of treatment. Don't hesitate to report to your physician about these symptoms, and don't worry that sometimes it seems like your symptoms are recurrent or that some days it may be different or not as well controlled as it is on other days. There are so many causes. Tracking your specific symptoms, knowing detailed information about what sets you off and helps you feel better is crucial information. Providing that information to your physician about the different circumstances helps your clinician know about the different causes that you may be having and how to manage each of those symptoms. Also, you will know what to take before or at the beginning of the symptom for improved management to help prevent these symptoms from getting out of control. Let's go through a few definitions. Nausea is the symptom of needing to vomit, feeling queasy, sick to your stomach. It might be associated with reflux or GERD, gastroesophageal reflux disease, but typically GERD occurs without nausea. Nausea is often painless, and some people just describe it as feeling yucky. Vomiting is the act of throwing up. It's a protective reflex, reverse peristalsis leading to forceful expulsion of the gastric contents. It's an intense and sustained contraction of the abdominal muscles and diaphragm. Typically, it occurs with nausea, but sometimes it occurs independent. Retching or dry heaves is the strong involuntary effort of vomiting without gastric contents expulsion. Keep in mind what I've said about symptoms in the past. Symptoms are your friend. They're telling you that something is wrong. Until the symptom is no longer your friend, but it's a nuisance, you already know. You know something is wrong. You may even already know what is wrong, and this is just an annoying reminder. These symptoms are so common. Many illnesses have a high percent of patients that report the symptoms of nausea and vomiting. For heart patients, typically it could be anywhere from 20 to 40% report these symptoms. For cancer patients, it may be 40 to 50%. For disease problems of the liver, it could be 30 to 50%. HIV patients, 30 to 50%. Patients with kidney problems, 30 to 40%. Illnesses involving the central nervous system, 10 to 40% report problems. And folks with GI diseases report may be as high as 40 to 70%. Even with good management, breakthrough can occur all too often, making this a wearing process mentally as well as physically for the patient, and increasing the frustration for the family, as well as resulting in more concern for the physician. Let's consider potential causes. Be mindful that there could be more than one cause affecting how you feel, which is why it's so important for you to track your symptoms. This translates into the complexity of evaluation and treatment. Because there can be several contributors, they can seem to take turns, possibly all occurring simultaneously or in an alternating pattern. You need to track those symptoms on an ongoing basis. Sure, it could be a food intolerance or an allergy resulting in these symptoms, so don't overlook that possibility. But for our purpose, we're going to consider other issues that might be at the root. Let's start with a symptom approach, and then we can break them down a little bit further. Brain-related issues, common sources may include migraine headaches, seizures, pain, tumor or mass effect. If it's gut-related, it could be local to the bowel or intestines or something affecting them. Infection, inflammation, irritation can all be factors, and toxins. Chemotherapy and radiation therapy have a reputation for instigating these symptoms, and sometimes it's not necessarily their doing, but they are treatments aimed at the cause of these symptoms. The tumor itself may be producing hormones or chemicals that are causing these symptoms. So you have compounding things causing the nausea and vomiting. We also want to consider other medications that are being used to treat your illness. Other medications for other medical issues may be at the root. If nausea and vomiting is caused by a medication, ideally we either want to reduce or eliminate that medication, or possibly we can change it to a different medication in the same class. Sometimes we can't do that. Now let's look at each of these in a little bit more detail. Anyone can develop an acute viral illness, so definitely consider that one, especially if there's someone else in the family that's being affected, or if it's a one-time event. If you have an inner ear problem or a vestibular mechanism issue, you may have had motion sickness in the past, so you recognize that spinning feeling. But benign positional vertigo is something that can strike almost anyone. And that's position that you get into. And when you get into that position or turn your head a certain way, it just feels like the room suddenly begins to spin. And it's not necessarily related to any other activity other than motion. Anxiety for some can be a definite contributor to their symptoms. Worry about something before an event or because of past experience, and that can be learned, so we definitely want to address that. The disease process itself in conjunction with any of these, or related to a medication being used to treat this illness. Let's talk about the enemy of our enemy. Medications, both enemy and friend. We're going to go through a list of common culprits by drug class. There is such a long list of medications, I can't name each one. And if you internet search your medications, it likely seems like every one of them has nausea and vomiting listed as a reported side effect. Some medications cause local irritation to the stomach. Others may stimulate the nausea center in your brain. Others may affect heart rate or your blood pressure, or may cause you to feel dizzy. And some can cause you to have an altered sensation of taste, with or without food. Sometimes you get taste perversion and you just feel like you've got a bad taste in your mouth. Chemotherapy has the reputation for nausea and vomiting that many people fear. And up to 40% of people receiving chemo can report nausea symptoms even with treatment. The anticipatory nausea before you have the treatment is a very real thing. And because that can be learned, we address that very aggressively. Acute nausea occurs within the first few hours, but it usually eases off by the end of the day of the chemo treatment. Delayed nausea and vomiting symptoms occur the following day or days after the chemo treatment. Other medication classes known to cause these symptoms: antibiotics, anti-anxiety medications, antidepressants, anti-seizure medications, Parkinson's meds. Nearly any medication that has the ability to cross the blood-brain barrier can cause you to have nausea. Blood pressure and heart medications, iron supplements and other vitamins, some lung medications, cannabis can cause nausea and vomiting, and some people take cannabis to alleviate their nausea and vomiting. Pain medications can result in nausea and vomiting both locally to your gut as well as centrally in your brain. For the record, nausea and vomiting that is caused by a pain medication does not necessarily constitute a true allergy, nor does a paradoxical reaction, where you're taking a medication for one effect and the exact opposite occurs. We do prefer to avoid those medications, but it doesn't mean that you cannot take those medications, and sometimes it can't be avoided. That's the medication we really need to use. Sometimes you're just in a different place, and now the medication that used to bother you no longer bothers you, so many things can be factors. Class of pain medications, specifically nonsteroidals or aspirin, steroids, and opioids, can all cause those nausea and vomiting symptoms. Again, either locally causing the issue or because they cross the blood-brain barrier in doing their job. When pain medications are the culprit, we may not be able to eliminate that medication entirely because typically those are required for comfort. So dose adjustment may be warranted. If good pain relief is achieved, but the associated symptoms can be reduced by a lower dose, we would try that first. We want to have good pain management still, but we want to also eliminate the side effects. Other times we maybe can change to a different medication within the same class to alleviate the symptoms. We prefer not to add yet another medication specifically to counteract the side effect. Like ripples in a pond, too many medications increase your risks. Drug-drug interaction risks will grow rapidly as more medications add up. Happily, sometimes the side effects of nausea and vomiting with pain medication will ease over time. You kind of become acclimated to the medication. For patients receiving radiation therapy, nausea and vomiting can occur for them too. Radiation is not something you really take into your body like a medicine that you swallow by mouth or have given a shot of, yet it does go into your body. And if you've ever had a bad sunburn, sometimes that night and the next whole day, you just feel terrible. If you consider it's a sunburn that goes all the way through your body, that might make more sense how radiation can make you feel bad. If it's radiation to the whole body, sometimes upwards of 90% of those patients can report having some symptoms. If it's just oropharyngeal, upper abdominal, or craniospinal, maybe half of those patients will report those symptoms. Brain, head and neck patients, if they're getting radiation to the trunk and pelvis, maybe as few as 20% will notice symptoms. And if it's extremities or breast, 10% may report symptoms. You will quickly see how several of these overlap. Disease states causing symptoms from multiple avenues, various hormone receptors that mediate the symptoms, and these hormone receptors are located in multiple places throughout our body. Now, if you don't want to get down into the weeds, skip this next section. The vestibular tract, your inner ear, that's where you might get your motion sickness. Inflammation, such as vestibular neuritis, whether it's a viral or a bacterial process, a vestibular tumor or a mass, possibly locally or chemically mediated by histamine or acetylcholine. And that typically gives you that spinning sensation, and it's positional. Gastrointestinal tract. Anything that irritates, obstructs, or slows down your gut. Gastroparesis, motility issues, such as caused by diabetes or a neurogenic process or a vascular problem or due to a tumor. Gastritis or ulcers can cause local irritation. Bowel distension and post-op nausea and vomiting is very common. In your gut are dopamine and serotonin receptors that can be mediating these symptoms. Next, we'll consider some toxic metabolites causing these symptoms. Again, occurring with advanced disease, indicating organ compromise or toxin buildup, possibly from a tumor or even a medication, or other metabolic issue, such as an electrolyte issue or a calcium problem, a sodium problem, a sugar problem. Your organs are supposed to be cleaning some of those toxins, whether it's from the medication or from daily byproducts of your body, and they can tend to build up. And that can give you those toxins that make you feel bad. The chemoreceptor trigger zone is at the base of the fourth ventricle of your brain. And neurotransmitters and biochemicals mediate this. It may occur with sepsis or medications, electrolyte issues, and is often related to organ compromise. These toxins are not being cleared, often mediated again by dopamine and serotonin. Your brain and cerebral cortex, your thinking center, anxiety or sight concerns, including unpleasant sights or smells or tastes or memories, as well as migraines, mass effect or tumor, increased intracranial pressure. These could be a sign of meningeal irritation if you're having nausea and vomiting, often mediated by GABA or gamma aminobutyric acid and histamine. Some of the other risk factors may include the age of the patient and their personal history, cognitive function, mental health history and personal experiences, advanced disease stage, physical activity and functional status, diet choices, sugary foods or fat-containing foods, fiber or fluid intake, and the patient's typical bowel habit. Don't underestimate the role of constipation in nausea and vomiting symptoms. Constipation could be from many causes, whether diet and fluid related or due to immobility or medication side effect. This is a long list, but it's certainly not the entire list. GI malignancies or an extraintestinal mass, an inflammatory problem or gut ischemia, scar tissue or stenosis in the gut. These are often mediated by endocrine and metabolic issues. So think about diabetes, electrolyte issues, kidney issues, pituitary and thyroid problems. Neurologic issues or slowing of the bowels are caused maybe by spinal cord history injuries, possibly due to Parkinson's, a history of stroke or paraplegia, multiple sclerosis, any number of a multiple group of autonomic neuropathic issues, possibly a connective tissue disorder such as scleroderma or amyloidosis. A rectal issue can play a role, such as hemorrhoids, fissures, strictures, irritable bowel disease, or proctitis. Many patients and families believe that missed bowel movements are acceptable, especially when the oral intake is reduced, but a bowel movement should be occurring every 3 days. Even if you're not eating at all, the gut lining is still turning over, and about 2 ounces of waste is produced every 2 to 3 days. So a soft bowel movement is expected even if it's not very much volume. Now let's get down into the weeds of the treatment. We want to try to identify the cause and can it be avoided. Your physician is going to want to know the times and many details about your symptoms. We prefer to use dietary measures first rather than medications if that's feasible and reasonable. We want to avoid offending foods, odors, and tastes. We recommend consuming bland foods that might be less likely to set these symptoms into motion. Small, frequent meals with foods that are lower in fat and non-gas forming foods. Some people do well with sour foods, lemons or pickles or hard sour candies. Other people find that repugnant, and they may find more relief with sweeter tastes, such as sherbets or simple calorie-dense carbs, drinking of clear liquids, regular soda pop, not diet soda in this case. Avoid eating or drinking for about an hour after vomiting because that process of reverse peristalsis sometimes can be recurrent. Use of homeopathic supplements can provide relief for some. Ginger-containing teas, candies, or tablets might provide relief. Now let's get into the details of more prescription medications. There are numerous medications, and each specifically targets one particular area or cause of these symptoms. This is why knowing the details of what triggers your symptoms is so important for your physician. You may need to go over some of this information more than once because it is intricate and can seem pretty convoluted. Medications can seem like it's a tangled web of overlapping receptors and locations. Possibly using an over-the-counter H2 blocker such as famotidine can help because it reduces the amount of acid in your stomach so that when you do throw up, there is a less caustic effect and it's less bitter for your mouth and throat. The PPI class, which includes medications such as omeprazole or pantoprazole, are of course much stronger, but they may take longer to become effective. These can be helpful, but they don't work as rapidly as the H2 blockers. Dopamine receptor antagonists. Typically, these are used for symptoms associated with nausea only. Keep in mind that dopamine receptors are located in the brain and gut, and this is what these medications affect. Commonly used medications that affect these may include prochlorperazine, promethazine, haloperidol, chlorpromazine, and metoclopropamide. Some of these are mental health medications, and they're being used off-label, but they can work oh so well to manage that nausea. Typical use for these might be chemotherapy-induced nausea and vomiting, or toxins associated with symptoms. These work to block the emetic pathway originating in the gut and the CTZ, as well as having the antidopaminergic effect. Reglan, or metoclopramide, has a direct prokinetic effect. Side effects may include extrapyramidal side effects, maybe weird movements, sedation, low blood pressure. So we avoid these medications in patients that already have movement disorders, such as with Parkinson's disease. The serotonin receptor antagonists, or 5-HT3, these drugs include ondansetron being the most common one. Zofran you've probably heard of. Ondansetron is the generic name, and I think that sounds like a transformer. Ondansetron. And it does transform your nausea and vomiting. For many people, they really get good relief with this medication. Indications for this medication include chemotherapy or toxin-related effects. The 5-HT3 receptors are in your gut as well as in your brain, and the mechanism is to block that emetic pathway. It's typically a preferred option for people that have a movement disorder such as Parkinson's or Lewy body, or if they've got restless leg, because it doesn't affect that dopamine receptor. So there's a lower likelihood of aggravating those disorders. Antihistamines, anticholinergics, antimuscarinics, for vestibular motion-related issues or inner ear pathology, these are typically used along with other medications to reduce those symptoms. Common medications in this group are diphenhydramine, hydroxyzine, meclizine, doxepine, scopolamine, and promethazine, which sounds sort of like prochlorperazine, but they're very different medications. Side effects of this group can include sedation, constipation, confusion, Orthostatic hypotension, which is when you stand up, your blood pressure unpredictably drops. Or dry mouth. Anxiolytics. These are very beneficial for people who are worried about a treatment or an upcoming visit. Typically, they're used for anxiety pre or post-chemo treatment. As we've described before, anticipatory nausea and vomiting is real and can be learned, so we definitely take that one very serious. Benzodiazepines are the most commonly used medication, with the go-to meds including lorazepam, oxazepam, or diazepam. Generally not going to use alprazolam for anxiety-related nausea and vomiting symptoms. These medications are often used together with other medications and typically not used alone. They work in the cerebral cortex pathway to reduce the nervousness and emotional upset that can lead to these symptoms. Side effects could include sedation, confusion, even to the point of having falls, so we worry about trauma when using these medications. Corticosteroids can be used to manage nausea and vomiting symptoms. Dexamethasone, brand name Decadron, sounds like another transformer, and it does transform that nausea and vomiting. Also, medications that are in this group may include solumedrol or methylprednisolone and prednisone. Indications for these medications are anti-inflammatory effects, maybe the management of bone pain. They can help reduce intracranial pressure, and they can also help stimulate the appetite. They work by reducing swelling and edema, as well as decreasing inflammatory mediators. Now, I don't want you to think they're going to decrease the swelling in your legs, because most likely they won't do that. They may actually worsen the swelling and edema in your legs because they will contribute to fluid retention. They can cause increased blood pressure, increase your blood sugar, and they can lead to mood swings that include anger, agitation, restlessness, or anxiety. They can lead to weight gain, which unfortunately is non-muscular weight gain. They can increase your risk of infection because they blunt and decrease your immune system response. And if they're used long term, they can lead to thinning bones and even cause fractures. So there's good and bad with each one of these medications, as you can see. Lastly, let's talk about a promotility agent that'll help with a slower stomach. Metoclopramide, brand name Reglan, which is much easier to say, is the more commonly used medication in this group, and it's used for gastroparesis. It does have some antidopaminergic effects, so we do watch the population that we use it in. There are potential side effects, including things like fatigue, drowsiness, agitation, anxiety, depression, or confusion. Long-term use of 3 months or longer, it could be associated with some really odd effects, such as breast enlargement, or risk of a weird facial movement called tardive dyskinesia, particularly in patients with renal or hepatic issues. They may notice some of these side effects. For patients with diabetes, Parkinson's, or if they're older than 70, we really carefully consider the risks and benefits of medications in this class, because those side effects can actually increase with these disease processes and increase with age. Wow, I hope that wasn't too mind-boggling for you, and thank you for staying with me for so long. This certainly has been an exhausting list of causes and possible treatments for these frustrating symptoms. There are so many causes for a person to have nausea and vomiting. Therefore, ongoing communication and coordination with your physician is a must, and please take notes and keep track of your symptoms. It might seem overwhelming, but rest assured, your physician is well educated to help sort out all of these symptoms and is taking everything into consideration when you tell them about your symptoms. Careful symptom consideration and tracking by you and your family is crucial to aid your physician and your team in the appropriate treatment to determine what the best recommendation to manage your symptoms will be. We want to choose the best medication suited to manage your symptoms, and then use these judiciously. Physicians don't like to shotgun and take a blast at something. We want to not assume that one medication is going to work for everyone's symptoms, but use the best medication directed at the most likely cause of your symptoms. Thus, knowing your symptoms and determining when those symptoms occur, you may have more than one cause of what your symptoms are, and you may need more than one medication. You may need medications for different symptoms and at different times. Because these symptoms are well known, they're often anticipated by your physician because of your health issue. They probably already have all the information in mind and are ready to provide you what you need before these symptoms ever occur. Hopefully, this has improved your knowledge about nausea and vomiting and helps you address these symptoms and understand why they are so distressing and why they can be difficult to treat. Not impossible, but but certainly a challenge. I hope that you and your medical team have success with identifying and managing these symptoms so that you can live each day to its fullest with an excellent quality of life. I hope that each day is the best that it can be. Thank you for being here, and as always, if I've missed something or if you have questions, drop a comment below or email us at the address in the description box. Your kind compliments are always appreciated. Bye now.